According to the National Union of Healthcare Workers, the Kaiser strike will officially go down in U.S. history as one of the longest strikes put on by mental health care employees. Mental health care workers have started to return to the office after 196 days. I'm Eric J. Docker, your Bakersfield neighborhood reporter. Now that the strike is over, what will change for the patients?
Some mental health care workers spent their last 7 months having to find outside work due to them holding their ground and striking for what they believed in. Some say they had their own private practice where they continued their caseloads, while others had to work part-time at other facilities to keep their family afloat.
We were able to be out here for nearly 7 months on strike, really asking Kaiser to meet us there. There were several negotiations that happened, and we made that progress. And now that we're back at work, we came back last week on Thursday.
But because of the uncertainty of an open-ended strike, we couldn't sustain large caseloads. So for me, carrying a caseload of 10 to 15 patients just to help me financially to be out as long as I could. For some of my colleagues, it was working, like I said, part-time or full-time in per diem jobs.
In a statement sent over by Kaiser, it states in part, the union was demanding pay increase. That would have meant wages that were nearly 40% above what others are paid in Southern California. In January, we offered the union a 19% wage increase, which they rejected at that time. This final agreement resulted in a 1% adjustment to that offer. The union demanded a change in their pension to a defined benefit plan. Instead, in our final agreement, we converted their existing defined contribution plan to a new design with the same costs to mitigate the concerns over escalating costs in the future. The new contract terms include 5 guaranteed hours per week for full-time therapists to perform critical patient care, 20% wage increase over 4 years, and $2,500 ratification bonus. A new cash balance pension plan that guarantees retirement income unlike a 401k.
When we decided to walk out on this strike, we did it for our patients, and we did it for the passion of the work that we do.
Since the agreement has been finalized, workers have started to return to the office. Their official first day back was May 8th. Workers tell me during the strike, they learned so much about themselves and their coworkers.
It's wonderful to be able to know my colleagues on a different level, very personal. We went through a lot during these last 7 months.
What do we want? Equity! When do we want it? Now!
We spent the holidays together. We went from Halloween, Thanksgiving, Christmas, New Year's, birthdays. Unfortunately, there was deaths in families, and we spent this time together, and we were able to be there for one another.
According to a healthcare professional, if you're a Kaiser patient, you may be eligible to a few sessions. They ask that you reach out to your healthcare provider for more information. For 23 ABC, I'm Eric J. Docker, your Bakersfield neighborhood reporter.